What tests are used to diagnose stomach cancer? When it comes to diagnosing stomach cancer, doctors use a variety of tests to get a clear picture of what's happening inside your body. The process often starts with a detailed review of your medical history and a physical exam. Your doctor will ask about symptoms like persistent stomach pain, weight loss, difficulty swallowing, or blood in your stool. They also consider risk factors such as family history, smoking, diet, or previous stomach surgeries. During the physical exam, they may check for tenderness, lumps, or enlarged lymph nodes in your abdomen. The most crucial test for confirming stomach cancer is an upper endoscopy, also called esophagogastroduodenoscopy. In this procedure, a thin, flexible tube with a tiny camera and light is gently inserted through your mouth and down into your stomach. This allows the doctor to directly look at the lining of your stomach and spot any abnormal areas. If something suspicious is seen, the doctor can take small tissue samples, called biopsies, using special tools passed through the endoscope. These tissue samples are then examined under a microscope by a pathologist to determine if cancer cells are present. The biopsy can also be tested for infections like Helicobacter pylori, which is linked to stomach cancer, and for specific markers that may influence treatment options. Imaging tests are also vital in the diagnosis process. A common one is the barium swallow, where you drink a chalky liquid containing barium that coats your esophagus and stomach. X-ray images are then taken to look for abnormalities like tumors or ulcers. While helpful, this test alone cannot confirm cancer without a biopsy. A more detailed imaging method is the computed tomography scan, or CORT scan. It uses X-rays to produce detailed cross-sectional images of your stomach, nearby lymph nodes, and other organs. This helps determine the size and spread of the tumor and whether the cancer has reached other parts of your body. Sometimes, a CORT scan guides needle biopsies if cancer is suspected elsewhere. Another important test is endoscopic ultrasound, which combines endoscopy with ultrasound technology. A tiny ultrasound probe attached to the endoscope provides detailed images of the stomach and surrounding tissues. This helps assess how deeply the cancer has invaded the stomach layers and whether nearby lymph nodes are involved. It can also help guide biopsies of hard-to-reach areas. Laboratory blood tests can provide additional clues. For example, they may check for anemia, which can occur if the cancer causes bleeding. Blood tests can also evaluate your overall health and how well your liver and kidneys are functioning. In some cases, tissue from biopsies is tested for specific proteins or genetic markers that can help guide treatment decisions, especially in advanced cases. Screening for stomach cancer is not routine in many countries like the United States because the disease is relatively rare. However, people with higher risk factors, such as a family history or certain genetic conditions, may be advised to undergo regular endoscopies to catch the disease early. It's important to remember that all diagnostic tests have limitations. Endoscopy, for example, carries a small risk of complications like bleeding or infection, and sometimes tests can miss cancer or suggest it when it's not there. That's why working closely with your healthcare team and discussing the benefits and risks of each test is essential. If you experience symptoms like ongoing stomach pain, unexplained weight loss, trouble swallowing, or blood in your stool, seeing a healthcare professional promptly is crucial. Early diagnosis can significantly improve treatment options and outcomes. Remember, no single test can diagnose stomach cancer alone, but a combination of these methods provides the most accurate picture. Always consult your doctor for personalized advice tailored to your health situation.